So hello everyone, our today's subject is endodontics and we are going to discuss the most important MCQ for your Neet, INCT and government job exam. So here comes the first question. In the Illumination test, the healthy sinus will transmit the light whereas the diseased sinus will appear opaque. Well, Illumination test, it is a procedure that is used to examine the sciences that are air-filled cavities present in the skull. So how this test is performed? So this test is typically performed to know the condition of frontal and maxillary sciences. So in this source, what we do is a light source is used. That is usually a small flashlight. That is the light we use is fiber optic light. So this light, it is placed against the skin on the patient face, typically over the area where the sciences they are located. Now, why do we use this fiber optic light? So question that comes in your mind is why to prefer fiber optic light? Well, the fiber optic light provides a focused and directed beam of light. So this light, it is well focused. So this focused light, it is essential for illuminating specific area of tooth effectively. So this fiber optic light will minimize the light scattering. So that will ensure that the transmitted light is more concentrated and directed. So if the sinus it is healthy and it contains the normal cells, so that will allow light to pass through it, so making the area appear illuminated or translucent. So that is why a healthy sinus will transmit the light. It will allow the light to pass through it and make the area illuminated or translucent. However, if the sinus is diseased, blocked or filled with abnormal materials, like there is pus or mucus, so it will not allow the light to pass through it, and that is why it will appear radiopaque. So a healthy sinus that will allow light to pass through, whereas the diseased sinus will block the light. That will result in opaque appearance. So answer B is correct. Now let us move to the another question. The percussion of tooth that is used to evaluate. Well, we know that percussion test, it is a valuable diagnostic tool in endodontics. So in percussion test, what a dentist will do, so suppose this one is the tooth and a dentist will start tapping on the incisal surface . So dentist will tap on the incisal or the occlusal surface of teeth using a blunt instrument like a mirror handle. So what is the goal of this test? So the goal of this test, it is to assess tooth response to mechanical stimulation. So remember, a dentist should always apply gentle force. So it is also important to note that the positive response to percussion, it does not mean that there is always an endodontic disease. Like other factors such as in case with the trauma to occlusion and periodontal disease that could even lead to positive percussion So when conducting the percussion test, you have to perform it both vertically as well as horizontally. So vertically along the long axis of tooth as well as horizontally. So we use a dual approach. So that will help us to differentiate between endodontic or periodontic problems. So if the patient experiences more sensitivity to horizontal uh, percussion than the vertical percussion, and there are no signs or symptoms suggestive of endodontic disease, it may point to periodontal origin of the problem. So in the horizontal, when you tap a tooth horizontally, that is side to side, so you are assessing a tooth response to the lateral forces. So that helps to determine if there is any inflammation or damage to periodontal ligament. While tapping the tooth vertically, that is up and down, assess the tooth response to the axial forces. A positive response to vertical tap may indicate pulpitis or periapical inflammation. Also remember the sound that we hear during percussion is also of diagnostic value. A hard, metallic sound that you feel during percussion in a horizontal direction, it indicates that the tooth it is locked in a bone. Whereas a dull sound will indicate to be extrusive luxation. So what are the other conditions where the percussion test is positive? The tender to percussion indicates that there is an uh, uh, inflamed like the teeth undergoing rapid orthodontic movement, high points in restoration, or a lateral or apical periodontal abscess. So these are the conditions where tenderness can be positive. Now let us move to the options. Ankylosis. The first option is ankylosis. Percussion can help to evaluate the ankylosis, that is condition where the tooth will get fused to the surrounding bones. So if the tooth it is ankylosed, it will produce a different sound and sensation upon percussion. So the sound elicited by percussion is of diagnostic value, as we have discussed that the hard metallic sound will tell us that the tooth it is locked in the bone, and the dull sound would indicate that there is extrusive luxation. Option 3, mobility. The percussion is also used to assess the mobility of tooth. The healthy tooth should have no little or no mobility. So if the tooth is mobile, it can indicate the condition like the periodontal disease or any trauma. So that is why your answer is option 1. So percussion test is a very significant test. You have to always compare the suspected tooth with the adjacent and the contralateral teeth. So the tenderness would indicates there is presence of inflammation that is present in the periodontal ligament. The cause of inflammation could either be pulpal or periodontal. Other important thing that you have to remember is the difference between the periapical and periodontal abscess. So remember this table for your entrance exam point of view. For your MCQ part, the answer is A. So let's move to the other question. How do GG drill differ from the Piezo Reamer? Well, GG drill, they are elliptical flame shaped burrs with thin shank. So these are the GG drills. They have a flame shaped burrs with thin shank. So this shank, it is thin. So this flame shaped head, it would cut laterally, and it is used with gentle apical pressure. So the long shaft, it is designed to break at the neck portion. So it generally breaks at the narrow diameter. So if the drill, it gets bind during use, it will fracture at the neck of the shaft. And the fracture segment, we can remove that fracture segment by grasping the broken shaft with the pliers and pulling it out of the tooth. The Piezo Reamer, they are similar to GG drill, but they have a longer cutting sides. With or without safe tips, and they are parallel rather than the elliptical shape. So GG drill, they have an elliptical shaped cutting edge, whereas the Piezo Reamer, they have a longer cutting edge which are parallel rather than an elliptical shape. So answer is C. You are performing a root canal on patient. The instrument that will be used to remove lingual shoulder and enlarge orifice of root canal is the GG drill. So now coming back to the GG drill, they will remove the lingual shoulder during access preparation, and they will enlarge the root canal orifice. So they are available in various size, number 1, number 2, number 3, 4, 5 and 6. So let's say a patient who has a curved canal and I need to gain access to the canal for cleaning and shaping. So I might use a GG drill for efficiently removal of the dentine that is obstructing the canal entrance. So the GG drill, remember, they remove the lingual shoulder during access preparation. So for removal of the lingual shoulder and enlarged orifice of root canal, we use is the GG drill. Now what about the Piezo Reamer? So suppose I am performing a root canal treatment on maxillary central incisor that has extensive caries and require both endo and restoration. So after completing the root canal treatment, the next step is to prepare post space for post and core restoration. So after thorough cleaning of the root canal, I find that the coronal portion of canal, it is irregular with pulp remnants and uneven dental walls. So in order to create a post space that is parallel, I will use a Piezo Reamer. So remember, Piezo Reamers, they are used for post space. Remember, Piezo Reamer, they are used for post space preparation. and they have a cutting side which are parallel rather than elliptical. So remember 3P for piezo reamer. So piezo reamer used for post space and they are parallel in design. So I choose a piezo reamer for post space preparation. So I select an appropriate piezo reamer that matches the diameter of post that I will plan to use. So the piezo reamer, it comes in various sizes to accommodate different post diameter. So remember the piezo reamers, they are available in various form of diameters. The number 1 has 0.7 mm size, whereas GG drill number 1 the size is 0.4 mm, and for number 6 the size is 1.4 for the GG drill, and for piezo reamer it's 1.7. So once my post space it is prepared to desired depth and diameter, I can proceed with the post core restoration. So the parallel sided post space that is created will be created by the piezo reamer. It will ensure a properly fitting post that is essential for the long-term success of the restoration. So for removing the lingual shoulder, I will use GG drill, and for preparing a post space, I will use piezo reamer. So answer here is B. Coming to the next question, which of following is a combination of apex locator and endodontic preparing instrument? So the answer is B, Tri-Auto ZX. Well, Tri-Auto ZX is a combination of apex locator and endodontic preparation instrument. So it is a third generation endodontic instrument that has an apex locator that will identify the precise measurement of the working length of the root canal, and along with that it has an instrument, endodontic preparation instrument, that will facilitate the cleaning and shaping of the canal. The option D, endo activator, it is a separate device that is used for sonic activation of the irrigants in the root canal to enhance the cleaning and disinfection. Whereas endo analyzer, remember endo analyzer, it is a combination of apex locator and pulp tester. And the combination of apex locator and endodontic handpiece is Tri-Auto ZX. So mark your answer of choice as B. Other question is, to sterilize the gutta pacha, we use remember is 5.2 sodium hypo for 1 minute. So 5.2% of sodium hypo for 1 minute. To ensure the sterility of gutta pacha cones, that is essential to prevent the introduction of bacteria into the root canal system during obturation. So we need to sterilize or disinfect the gutta pacha cones. That is done by using sodium hypochlorite for 1 minute. Moving to the next question, the apex finder has a visual digital LED that is self-calibrating. The endo analyzer, it is a combined apex locator and pulp tester. So both the statements, they are correct. The apex finder, they has a digital LED indicator. that provides the visual representation of the instrument position within the root canal. So when performing a root canal, an endodontist it uses a apex locator to measure the working length of the root canal, and the LED indicator helps to visualize the progress of instrument as it reaches the apex of the root. So option A is correct. Option B, the endo analyzer, it is combination of apex locator and pulp tester. So this one is the endo analyzer. It is a combined apex locator and pulp tester. So that will help the dentist to determine the length of the root canal using apex locator technology and simultaneously assess the pulp vitality. So the correct statement is both of them statement, they are true. Moving to the next question. The instrument that is used to adapt and condense gutta percha into canal during endo treatment, it is spreader. Well, the spreaders, they are more flexible. They are used for vertical condensation. And they have a tapered tip. While the pluggers, they are less flexible. And they are used for lateral condensation. And they have a flat tip. So the instrument that we use to condense gutta percha points into canal during endo treatment, they are spreaders and pluggers. A gutta percha is a material that is used to fill and seal the cleaned and shaped root canal space after the removal of the infected tissue. So let us say I have performed a cleaning and shaping of the root canal using various endodontic files and reamers. So after the canal it is properly cleaned, I would select a proper size gutta percha points that are the tapered cone material. So I would use the spreader end of the spreader or plugger to laterally compact the gutta percha within the canal, ensuring a snugly fit and sealing any irregularities. Following the lateral compaction, I would use the plugger end to vertically compact the gutta percha and condense it further. So my goal is to create a well sealed and hermetic seal within the root canal, preventing any infection or microbial ingress. Other options are the GG burrs. They are the rotary cutting instruments with elliptical shape. Already discussed them previously. Endodontic plugger instruments already discussed. The endodontic spoon excavator, it is a hand instrument that is used to remove debris, pulp remnants and soften dentin from the pulp chambers and canals. So when performing the initial cleaning and shaping of the cess cavity before using rotary instrument, an endodontic spoon excavator that can be used to remove pulp tissue and debris. Broaches, they are the thin flexible instrument with barb edges that engage and remove the pulp tissue and debris from the root canal. Let us move to the next question. The major determining factor that influence the efficacy of the root canal debridement, it is the internal space anatomy. So let us discuss all the options one by one. The first option is type of hand instrument. While the choice of hand instrument does play a role in root canal debridement, it is not the major determining factor. Many cases may require different type of instrument, but it's the anatomy of the internal pulp space that ultimately tell us the efficacy of debridement. Like in case with the complex and curved canals, you might use specialized hand instrument like K files, H files, but the effectiveness of cleaning and shaping will still depend upon the internal anatomy. Option B, irrigating solutions. They are important for disinfection and debris removal during the root canal. So what the solution will do, they will help you to flush out debris and disinfect the canal. So the important choice of irrigating solution alone, it does not determine the efficacy of debridement. So the most commonly used irrigant we use is the sodium hypochlorite. Due to its antibacterial properties, it helps to clean and disinfect the canal. The other is the option D is the instrument technique. The technique that we use during instrument, it is significant in achieving proper debridement, but it is still secondary to the internal pulp space anatomy. So correct instrumentation techniques like crown down, step down, they are essential for efficient cleaning and shaping of canal. But even with the best technique, if the canal has complex anatomy or irregularities, complex debridement may be challenging. So your preferred option is C, that is internal space, pulp space anatomy. So the internal pulp space anatomy, including the number of canals, their curvature, branching, and any anatomical anomalies, it is the primary determinant of debris removal. Imagine a tooth with multiple curved canals and accessory canals. So regardless of the instrument or the technique used through debridement will be more challenging in this case due to the complex internal anatomy. So the choice of instrument, irrigation solution and technique, they are important in root canal debridement, but the internal pulp space anatomy, they play a most important role in influencing the efficacy of the procedure. Moving to the next question, the basic difference between K-type file and Reamer is it's the number of spiral or flutes per unit length. The K-type files, they have multiple spirals or flute along their length that allow it for efficient cutting and debris removal, whereas the Reamer, they have fewer spirals or flute per unit length. Option B, the geometric cross section. The K file typically has a square or rectangular type cross section. So this design provides sharp edges and corners for effective cutting, whereas the Reamer, they have triangular cross section that allow for efficient cutting and dentine removal while creating taper in the root canal. Option C, the depth of flute. K file often have deeper flutes compared to Reamers. The D flutes provide more space for debris removal and enhance cutting efficiency. The direction of spirals, K files have a helical design with spirals running diagonally along the length of file. So the best answer, the basic difference is number of spirals or flute per unit length. The K files, the K type files, they have a more number of spirals or fluid per unit length, whereas the Reamer, it has less fluids. Coming to the next question, the gates, grid and drill, they are, well, the gates, grid and drill, we already discussed them. They are the rotary instrument. They are generally inflexible and they are used at a low speed. So when preparing the access cavity for the root canal treatment in the anterior teeth, GG drill is used at a low speed to remove the dentine and create a straight pathway to the pulp chamber. Pre-curving is indicative. So the pre-curving, it is indicative not for the files size 35 and over. It is indeed beneficial for the file size that are smaller and more flexible one. So decision to pre-curve file, it depends upon the specific canal curvature and the characteristic of file that is being used. For smaller, more flexible files, pre-curving, it can help them to navigate through curved canals more effectively and preventing complications like ledging and transportation. So let us consider a maxillary first molar with a mesiobuccal canal that has a slight curvature. So attempting to navigate this canal with a straight file could lead to difficulty in reaching the apex. So in this case, what I will do, I would pre-curve the file to match the curvature of the canal. That will make it easier to negotiate the canal safely and effectively. Next option is in canals which are partially calcified. So in this case, I would recommend to use other files like C files. They are used in endodontics, generally used with the calcifications. So they have a known cutting tip and they can be more flexible. So while dealing with the tooth that has a calcified canal, first of all, you should the patient history, clinical examination and diagnostic imaging like X-ray and CBT scan. We need to get the clear understanding of the extent and location of the calcification. We can use various chelating agents like EDTA or citric acid that are used to soften and dissolve the calcified canals. So these solutions, they are introduced in canal and these are used for the removal of the calcification. So C and C plus files, stiffer small diameter hand files like C plus files, they are used to remove the loose, partially softened calcified tissues. Ultrasonic tips. So use of ultrasonic tips along with the Muller type burrs. They can be used to manage the calcifications. So the ultrasonic vibration, it helps to break down and remove the calcified deposit. Apart from that, we can use a microscope that would enhance the visibility. So your answer is B. The Hero, it stands for the Hero shapers. It is a micro mega niti files. The Hero stands for high elastic in rotation. So it was, remember, the Hero files, they were first originally known as Hero 642, which has been now being renamed as a Hero shapers. The cross section of Hero shapers, it is similar to H files, but without radical lengths. So Hero shapers, it comes in two sizes. with various length and colors. So it comes in red color, blue color, and the yellow color. So it comes in two sizes. Coming to the next question, the electric pulp test shows a false positive response in case of, well, remember this table from Cohen's. The false positive response, it is seen in partial pulp necrosis. That's patient with high anxiety, highly anxious patient, contact with the metal restoration, and ineffective tooth isolation. So your answer here would be options that would be correct would be A, B, and C. Whereas the false negative response, it is seen in the immature apex. So that is incorrect, as false negative response is seen here. Recently traumatized tooth, again false negative test is seen. So answer is A, B, C. The other condition where false negative response can be seen is if drugs that increase patient threshold for pain, poor contact of pulp tester to the tooth. Moving to the next question, the histological dental pulp, it is divided into, the answer is B. Well, the pulp, it is divided into odontoblastic layer, cell-free zone, cell-rich zone, and the core zone. So the odontoblastic zone, it is the, remember the outermost zone is the odontoblastic zone that is responsible for the dentine formation. The cell-free zone of the wheel, it is the cell-free zone, it is the zone of wheel. It is zone where the fewer cells are there. So this zone would contain fewer cells with fewer nuclei. It is primarily composed of ground substance. The cell-rich zone, it is rich. It is the region within the dental pulp that contains higher concentration of cells that are the fibroblast, immune cells, and undifferentiated mesenchymal cells. The core zone, it is the central region of the pulp. It contains blood vessels, nerves, connective tissue. Well, the granular layer of tomes, it is not typically a histological division of the dental pulp. It is more associated with the ameloblasts, cells that are responsible for enamel formation. So that is why your answer is A, B, C, and D. 1,1,2-tetrafluoroethane, it is used as a pulp vitality testing. So it is most commonly available as refrigerant in various. So that is used for pulp vitality testing. So pulp vitality testing, we know it is a diagnostic procedure that is used to assess the health of dental pulp. So the most reliable test is the cold testing. So the most common diagnostic method to assess the vitality of the tooth pulp is the cold test. So what are the various tests that we can perform? Regularize. The traditional method is to use regularize, where piece of ice it is used to provide cold stimulus to tooth, or carbon dioxide ice. This method involves the special equipment to apply extreme cold carbon dioxide ice to the tooth. So device that we use So the device that we used, it is known as Odonto Test. Apart from that, we can use is a refrigerant spray. So it is a convenient method. It delivers a cold blast when spray on cotton pellet that is applied to the tooth. So after isolating the tooth and ensuring it's dry, we apply a cold stimulus using a cotton pellet soaked in refrigerant. So tetrafluoroethane, it is typically found in the canned air or refrigerant spray. So if the pulp it is healthy, the patient would feel a sharp, briefy pain in response to cold. This is normal reaction. If the pain experience is intense and prolonged pain is seen, it indicates the irreversible pulpitis. It means that there is severe inflammation and the tooth may need a root canal treatment. If it does not respond at all, it suggests that pulp is necrotic and root canal treatment it is indeed. Sometimes a false negative response can happen if the tooth has very narrow canals, or the term we use is calcific metamorphosis. In such case, the cold stimulus it may not reach the pulp effectively. Remember, the cold testing it is more effective on front teeth than on the back teeth, as the front teeth they are less insulated. Moving to the next question. For irrigation in case of open end needle is placed at how much distance from the apical foramen? The answer is 3 mm. So the irrigating tips they are inserted apical to within 3 mm of the working length. Suppose a dentist he is performing a root canal on the teeth and the working length of the root canal it is determined the working length it is determined to be around 20 mm. So in this case, the open-ended irrigation needle that is inserted at a depth of 17 mm from the coronal reference point so that this placement would allow for effective irrigation without causing any extruding of the irrigants out of the canal. The re-implanted tooth is wrongly placed in socket. That can be corrected up to, the answer is 48 hours. So after a traumatic incident where a tooth is re-implanted but placed incorrectly, there is a limited window of time period during which the correction can be made. So this time frame is usually 48 hours. Highest concentration of MMP found in the inflamed pulp. They are, so MMP we know they are the group of enzymes that play a significant role in tissue remodeling. In dental pulp, they are involved in processes like inflammation, wound healing, and tissue repair. So in case of pulp inflammation, which can occur in reversible and irreversible pulpitis, the balance of MMP and their inhibition can be disrupted. Inflammation it triggers an increase in production of certain MMPs like MMP3. This MMP3, it is also known as stromatolysine 1. So it has a unique and prominent role in pulpitis. MMP3, it is known to activate other MMPs like MMP1, MMP7 and MMP9. So MMP3, when produced in pulpitis, it is associated with angiogenesis. That means there would be formation of new blood vessels. There will be fibroblast mediated wound healing and reparative dentin formation would be occurring. So this enzyme, it is example, a patient with irreversible pulpitis in a tooth. So inflammation in the pulp, it has caused damage and the tissue need to heal. So here the MMP3 plays a crucial role. They will break down the collagen. MMP3, they would break down collagen in the inflamed area, leading to changes in the extracellular matrix. So this change in extracellular matrix structure, it is responsible for tissue repair and this angiogenesis, so that are necessary for healing the inflamed pulp. So while MMP3, they are elevated in inflamed pulp, the other MMPs like MMP2, MMP8, MMP9, they are found in lower concentration in these conditions. So remember, the MMP3 stands out with the highest concentration in the inflamed dental pulp compared to the normal pulp. So remember, these MMPs, they help to maintain the equilibrium between the synthesis and degradation of collagen in the periodontal tissue. So they play a role in the normal turnover of the periodontal extracellular matrix. So in the conditions like periodontitis, there is overexpression of these MMPs. So MMP again would break down collagen, leading to destruction of the periodontal ligament. So that would cause tooth mobility and tooth loss. In chronic periodontitis, the MMP 8 and 9, they are elevated in GCF. So they would result in degradation of the collagen fibers and leading to attachment loss and periodontal pocket formation. What is the role of MMPs in the endodontic diseases? MMPs, they are present in dentine and they are involved in physiological turnover of the dentine matrix. In the reversible pulpitis, mild inflammation would bring out the release of MMP to break down dentine for immune cell migration. So in severe pulpitis, excess MMPs can lead to pulp damage and necrosis. So in the endodontic therapies, may target MMP to reduce the inflammation within the pulp and limit the damage to dentine and the pulp tissue. Moving to the next question, the Minitol that we use in local anesthesia, the Minitol, the answer is it decreases the permeability in the nerves. Minitol, it is a not common component of the local anesthesia solution that we use. So Minitol, is primarily used in neuroanesthesia to reduce the intracranial pressure and volume, so that it achieves this by osmotic action and vasoconstrictive properties. So that helps to reduce the swelling and pressure in the brain. So it decreases the permeability in the nerves. That's its main role. So identify this device. This is XStep intraosseous anesthesia delivering system. So let us discuss them one by one. The first is a comfort control syringe. So comfort control syringe it is a dental instrument that is used for precise control and delivery of local anesthesia solution. A dentist may use this syringe to give a local anesthesia to numb a specific tooth. So it has a barrel. The main component of syringe is the barrel. That will control the amount of solution that has to be given. Other is thumb ring that is located near the rear of the syringe where the dentist thumb would rest. That would provide stability and control while delivering the anesthesia. Other is the plunger. So plunger, it is the movable part within the barrel. So when pushed, it will dispense the anesthetic solution throughout the needle. It has a piston that is attached to plunger that controls the flow of anesthesia. So these comfort control syringes, they are designed to minimize the discomfort during injection. The slow and controlled administration of anesthesia reduces the sensation of pressure or burning that patient may feel. Other is the XStep anesthetic delivery solution. So this is XStep. So it resembles a small disposable syringe that is inserted into a hole in the bone. So the local anesthesia, it is delivered directly into the bone through the XStep, providing a rapid and effective numbness to the treatment area. So it is an intraosseous anesthesia delivering system. Other is Vibraject. It is a device that attached to a standard anesthetic syringe and delivers vibration to the needle. So the vibration would stimulate sensory receptors and make injection more comfortable to the patient. So this vibrating action would reduce the sensation of pain or discomfort that is associated with the needle insertion. So it has a generally vibrating mechanism that is activated when syringe is in use. So as the dentist insert the needle into the gum, the vibrating action, it begins. So the goal is to make patient less aware of the injection and minimize the sensation of discomfort or the pain. Moving to the next question, the owl's tooth. It is soaked in sodium hypochlorite chloride, then it should be soaked in 2% sodium fluoride for 10 minutes. So imagine a scenario where a patient has an accident resulted in knocked out tooth. So sodium hypochlorite, it is used as initial step to disinfect the worst tooth. So that helps to remove the contaminants and reduce the risk of infection. After that, sodium fluoride, after disinfecting the tooth, the next step is to soak the tooth in a sodium fluoride solution. So the sodium fluoride is used for its ability to promote tooth vitality and increases the chances of successful reimplantation. So the sodium fluoride, it is known to enhance the chances of successful reimplantation as it helps to re-establish the blood flow and nourishment to the PDL that is important for the tooth survival. The recommended time is 2% sodium fluoride for the 10 minutes. Moving to next question. A 8-year-old child reports with a fractured upper central incisors with a history of trauma 1 year back. On examining, the pulp is necrotic, but no periapical radiolucency can be seen. So what would be your choice? So apexification with MTA is your choice. Well, the apexification, it is a common endodontic procedure that is used when a non-vital tooth, the permanent teeth, has incompletely formed roots. So in this case, the child tooth is non-vital. However, there is no periapical radiolucency. So that means that the infection has not spread beyond the tooth apex. So dentist will perform apexification by using MTA. MTA, it is a biocompatible material that is placed at the apex of tooth root to create a barrier that would prevent the further infection and encourage the formation of hard tissue barrier. So MTA would continue to promote continued root development and strengthen the tooth. That is most important in growing child. Over time, the tooth root will continue to develop and tooth will be more resilient. So apexification, it is preferred over extraction as it preserves the natural tooth and its function. Extraction, on other hand, would lead to loss of the permanent tooth that could have a long-term implication for dental health and function. Moving to the next question. The gutta percha in contact with the connective tissue is which of the following? So when the gutta percha, it comes in contact with the connective tissue, it undergoes certain changes that can be considered unstable. So why gutta percha, it is unstable in connective tissue? Gutta percha, it is a thermoplastic material. It is designed to be stable and biocompatible within the confines of root canal, where it is sealed from the surrounding tissue. However, when it is exposed to connective tissue outside the root canal, that can be influenced by various factors like temperature changes, motion, and body immune response. So let's say during a root canal procedure, a tiny amount of gutta percha extrude through the apex of the tooth root and it comes in contact with the periapical connective tissue. So in this case, the gutta percha may soften or deform due to exposure to the bodily fluids and different temperature conditions outside the root canal. So remember, the gutta percha, it is always chosen for its stability and biocompatibility within the root canal. So it is not meant to be in contact with connective tissue or other external tissues. So when it is outside its intended environment, it can lose its physical properties and hence it can become unstable. The rubber dam cannot be used for following conditions. The answer is C. So, rubber dam can be challenging to use on the partial erupted teeth when there is limited access to the crown of tooth. When the teeth they are severely tilted, their position can make it challenging to secure the rubber dam. So the dam may not fit properly around the teeth, making the isolation difficult. Some patient may have allergy or sensation to latex, that is common, which is the common material that is used in rubber dam. So that is your answer of choice is 1, 2 and 4. The rubber dam, remember, it cannot be used in asthmatic patient and mouth breathers. So this question is from NBD. Mark answer is C. A 14-year-old boy while playing hockey has his maxillary central incisor avulsed and he immediately placed them back in socket. So he reported to clinic within 15 minutes of trauma. What is the treatment plan for this case? So the patient acted quickly by reimplanting the avulsed tooth within 15 minutes of trauma. So this immediate action can be significantly improve the chances of saving the tooth. The physiological splinting refers to stabilizing the reimplanted tooth in its original position to allow for natural healing and reattachment of periodontal ligament fibers. So the physiological splinting, it refers to stabilizing the reimplanted tooth in its original position and allowing for the natural healing and reattachment of periodontal ligament fibers. So the periodontal ligament that attach the tooth to the bone, they need time to reattach and heal. A physiological splint, usually made up of flexible wire, it is placed over the affected tooth and the neighboring tooth to stabilize it. So the physiological splinting, that it would support the natural healing process by maintaining the tooth position and stability. The endodontic loop magnification is, the answer is A. The endodontic loops typically offer a range of magnification twice the size and 6 times the size. So that this range is suited for the endodontic procedure. The 4x to 16x magnification might be excessive for many endodontic cases. The higher magnification, it is used for microsurgeries. 10x to 20x, uh, they are routinely not used for routine endo work, and they are more common in micro surgeries. So your answer is A. The largest component of gutta pacha points. Well, the largest component is the zinc oxide. That has percentage of 60%. So zinc oxide, it makes gutta pacha radio opaque. So meaning that they are visible on X-rays. So the incorporation of zinc oxide, it helps to give the gutta pacha the necessary strength. The presence of zinc oxide allows for clear visualization of the gutta pacha material on X-ray. Apart from that, it contains gutta pacha in concentration of 18 to 22% that acts as a matrix. The waxes or resins, so they improve the handling characteristics and adaptability of gutta pacha during placement within the root canal. So the largest component is the zinc oxide. The primary function of access opening is to provide a straight line access. So the access opening, it is the initial step in the root canal treatment. It involves the removal of tooth crown portion to gain access to pulp chamber and root canal system. So why we need a straight line access? So thus creating a straight line access to apex, it is the fundamental objective in the endodontics. For the reason, the straight line access allows for the efficient and safe instrumentation of the root canal. So it ensures that the endodontic files and instruments, they can reach the full length of canal without any complication like the ledging or perforation. Effective cleaning and shaping. A straight line access enables through effective cleaning and shaping. So that is essential for removing the infected tissues and debris. So that allows for better visibility, and that is why a straight line access is important. The rubber dam was introduced by S.C. Barnum. So these are the advantages of the rubber dam using regularly. Remember them.